Hi, everyone. I'm Dr. Nakul Bhardwaj. I'm currently a gastroenterology and hepatology fellow here at the University of Utah and also an obesity medicine specialist. I'm excited today to speak to you about the connection between obstructive sleep apnea and obesity. So let's start by talking about what obstructive sleep apnea, or OSA, actually is. So during normal sleep, air flows freely through your nose and mouth into your lungs. Your airway stays open and oxygen levels remain stable. Your body gets the restorative sleep that it needs from this whole process. However, in obstructive sleep apnea, the soft tissues in the back of the throat, such as the tongue and the surrounding muscles, relax too much during sleep. And when this happens, this can lead to the airway becoming partially or completely blocked. This leads to what we call an apnea event, which is when airflow is almost completely stopped for at least 10 seconds at a time. These pauses in breathing can happen dozens or even hundreds of times a night, often without the person realizing it. And each incident briefly lowers oxygen levels and forces the brain to wake the body just enough to restart breathing. Over time, this repeated cycle severely disrupts sleep quality and puts strain on multiple organs. Obesity, in fact, is the single strongest risk factor for obstructive sleep apnea, and this connection is very important to understand. Excess fat tissue can build up around the neck and throat, narrowing the pharyngeal airway. This makes the airway smaller and much more likely to collapse during sleep. In addition, fat tissue around the abdomen pushes up on the lungs, reducing lung volume and decreasing the natural tension that helps to keep the airway open at night. The severity of sleep apnea often increases as body weight increases. In fact, about 40 to 60% of people with OSA have obesity. And research shows that the risk of OSA increases sixfold with every 10% increase in body weight. This means that even modest weight gain can significantly worsen sleep apnea. And on the other hand, even modest weight loss can meaningfully improve it as well. Many people with sleep apnea don't realize they have it because the symptoms occur during sleep. So let's discuss some of those symptoms. So the common symptoms include poor sleep quality, excessive daytime sleepiness, frequent awakenings, insomnia, and restlessness at night. Bed partners may notice loud snoring, pauses in breathing, or gasping and choking sounds during sleep. And oftentimes, morning headaches can also occur. If you experience daytime fatigue, trouble concentrating, or if someone tells you that you stop breathing while sleeping, these are important warning signs. Patients should bring these symptoms up with their healthcare provider as soon as possible, especially if they have obesity, high blood pressure, diabetes, or heart disease. Sleep apnea is common and treatable. Untreated obstructive sleep apnea affects far more than just sleep. Over time, it increases the risk of cardiovascular disease, stroke, type 2 diabetes, worsening obesity, depression, anxiety, memory, and concentration problems, along with erectile dysfunction and loss of libido. It also raises the risk of motor vehicle accidents and work-related injuries due to impaired alertness. Poor sleep quality has a profound effect on daily life, impacting our mood, relationships, job performance, and overall health. And many patients don't realize how much better they can feel until their sleep apnea is properly treated. So, in terms of how sleep apnea is diagnosed, screening often starts with the Stop Bang questionnaire as listed here. This includes 8 questions that relate to snoring, tiredness, observed apneas, blood pressure, body mass index, neck circumference, age, and gender. These categories all help to estimate a person's risk for sleep apnea. If there is clinical suspicion, the next step is to perform sleep testing. Many patients can start with a home sleep apnea test or sleep study, which is convenient and effective for moderate to high risk individuals with sleep apnea. However, some patients benefit from an in lab sleep study, And these include patients who may have a lower suspicion or a lower risk of sleep apnea, or those who have multiple comorbid conditions, including heart failure, lung disease, neuromuscular conditions, or even more complex sleep symptoms that would be better picked up or better suited for an in-lab sleep study. There are several effective therapies for obstructive sleep apnea, and I wanted to list them here. The treatment options can include sleep hygiene improvements, alcohol avoidance, smoking cessation, positional therapy, using oral mouth appliances, continuous positive airway pressure or CPAP treatment, or even surgical options. And finally, weight loss. Weight loss is one of the most powerful tools we have to improve sleep apnea. Reducing excess body fat decreases pressure on the airway and lungs, leading to fewer breathing interruptions or apnea events and better oxygen levels during sleep. Modern anti-obesity medications, when combined with lifestyle changes, can also produce meaningful and sustained weight loss. Studies show that weight loss, whether achieved through lifestyle changes, medications, or surgery, can significantly reduce sleep apnea severity and, in some cases, even lead to remission of obstructive sleep apnea. The most effective approach is individualized, and often we like to combine multiple therapies for patients. Treating both obesity and sleep apnea together leads to better sleep, improved energy, and better long-term health outcomes. At the end of the day, obstructive sleep apnea and obesity are deeply connected, but the good news is that both are treatable conditions. Addressing weight is not about blame, but it's about improving your sleep, health, and quality of life. If you suspect sleep apnea, please talk to your healthcare provider.